It's a very interesting demographic because it's a rural community, but we're also only about 60 miles away from a major metropolitan area. So it's kind of an interesting demographic. Definitely skews more on the lower socioeconomic status. You know, we have a lot of people that live below the poverty line. You know, there's a lot of people here who are on Medicaid, a lot of people here with food insecurity.
There is a small convenience store, but the prices tend to be a little bit more inflated because it's so far out here. Most of the people that go grocery shopping go 26 miles away into Bay City to shop.
I didn't realize that people have difficulty putting food on their table. And you know, I think, oh, I can put food on my table. You never think about other people may have a hard time, even people that you see every day.
Van Vleck, Texas is located about 70 miles southwest of Houston. So if we wanted to go to a grocery store, we would have to go 6 miles over to Bay City, which is also in Matagorda County, to purchase groceries and that sort of thing.
That's sometimes difficult because some of our students' families don't have access to renting vehicles and things like that so that they can actually get to town to buy groceries.
If you come into my office and you're overweight, and I say, hey, the easiest way to fix this problem is for you to eat better. But if you don't have access to healthy food, how can I expect you to follow my instructions? If all you have around you in terms of affordable food is fast food options, is unhealthy options, if you don't have access to vegetables, fruits, how can I expect you to lose weight? I can't.
We want to be able to provide the ability for those people to have those healthy foods. So we can target things such as high blood pressure, food insecurities, high cholesterol, teach them and educate them on the importance of healthy eating.
So naturally, when we were focusing on the social determinants of health, we wanted to address the food scarcity that's in Matagorda and Wharton counties. And when we were presented with the opportunity by Methodist Healthcare Ministries to pursue that, we decided to contact the local schools, and through them we've now put in 2 gardens, and in the upcoming year we plan to expand one of those and to expand yet into another school. And we're doing in the ground gardening as well as putting in greenhouses where we're doing hydroponics and aquaponics.
With the hydroponics, that's basically a soilless media, and you use different types of soilless media type things like rock wool, which you would use rock wool to set the plant in, and then that's set into a perlite for the Beto buckets. And then we also use what they call an NFT tray, which is like nanofilament transfer. So it uses like nutrients in just a small amount and keeps the roots wet and kind of runs over the roots and grows that way. So it's basically nutrient growing instead of soil growing.
While we have agricultural science classes, we do not have horticulture or an opportunity like what the greenhouse is going to bring.
Watching a student see something grow from a seed and then getting to eat some cabbage on their plate or a carrot that they grew, there was a lot of learning going on there. So then once I heard about an actual greenhouse and how we were going to be able to implement lessons from kindergarten all the way through 12th grade, that could even lead to things like industry-based certifications for students to take with them after high school. That's a very exciting concept for us.
You know, when you're growing a community, when you're providing their educational needs, you also need to make sure that they have that substance that not only makes them healthy, but also gives them that comfort.
It's the simple act of creating this healthy, accessible food source. You know, we're trying to create these partnerships with the schools to educate the kids, the community members, so that way they can come in, they can learn how to grow these foods, they can learn how to utilize these foods, they can learn how to live healthier lifestyles, which hopefully leads to a better and happier life for them.